Good morning, everybody, and welcome to an IBS hypnosis protocol video. So, hi guys, hi Michelle, Megan. Let me know that you're out there. Give me some love hearts, give me a comment, say good morning. So today I'm going to be talking about the testing for IBS. So when it comes to the testing, this video is going to cause probably a fair bit of flap. So I'm going to get some very controversial comments on my YouTube channel and things like that. If you are watching this on YouTube, please subscribe to the channel. Just simply tap on it and hit that bell so you can get reminders when we release new stuff as well. So let's talk about the testing for IBS and see how much controversy we can start and see how much shit we can get Trish into, okay? So here we go. So this is going to be a controversial topic, absolutely. So feel free to comment. I'm open for discussion and education on this one. I am absolutely willing to hear about new products or services that might be available because I'm always looking to update my library as well. Now, if you feel a need to take this video as a personal judgment, please take some time out to address your emotional needs because this video is probably not for you. This is not about defending IBS or anything like that. This is about getting some facts out there that we know are happening in our industry. So if you're going to take this as a personal judgment, then please just move along and continue on just enjoying your day and go and have a cup of tea, okay? This is not a personal attack on anybody. So before I start, since October 2017, we've now run 18 successful events all across Australia. Hi Megan, hey beautiful. We've also trained over 170 people in the IBS hypnosis protocol. This is gut-directed hypnotherapy. We had the AHA approach us at one of our events and say, we need your stuff. So now if you are registered with the AHA and you need those 10 CPD points for ongoing training, please attend one of our live events and we'll sign that off for you. We've also released the IBS Hypnosis Protocol online to reach people outside of Australia, and we will be in New Zealand in November. Totally pumped and excited about that. So if you are in New Zealand and you're looking to come to the IBS Hypnosis event, please jump onto our webpage. We do have pay plans available. So Melbourne is done. That was great. Adelaide, oh my gosh, Adelaide was so relaxing, cruisy. Sydney, fantastic. I loved meeting everybody. We're up for Perth in a couple of weeks. We've only got 6 seats left. So if you want to come to Perth, please jump onto that link ASAP. Brisbane is already half sold out and New Zealand has started selling tickets as well. So we will sell out and we do have payment plans starting from as little as $40. So it is completely affordable. And no, we have not charged you any extra for being on a payment plan either. We need more gut-directed hypnotherapists. We have more people that are trained in quit smoking than what we do actually have people who are smokers. There are more people suffering from IBS in this world than smokers. So it's a no-brainer, this one. It really is. And the IBS hypnosis certification also helps people with Crohn's, colitis, and other gut-directed issues as well. So here we go. Let's get into a discussion. Testing for IBS, how is it done? Well, you see, here's the thing, okay? We don't have a definitive diagnosis for IBS. The doctor is likely to start with a complete medical history. So first they'll do a physical exam, they'll do tests that will rule out other conditions. So that's what they're doing. They're ruling out other conditions that might be more serious. So if you have diarrhea, for example, you may be tested for gluten intolerances, so celiac disease and things like that. If you have constipation, the doctor will assess your dietary needs. Are you eating the correct foods? Are you drinking enough water? Are you getting enough fitness into your life? The doctor will also assess you for things like fever, abdominal pain, even anemia. So are your iron levels low? Perhaps you're in an area like we are where vitamin D is a very huge issue. So you will get tested for vitamin D, lack of vitamin D. Even lack of vitamin B is a huge thing here in Mount Gambier as well. So you'll be tested for all of those other things. You'll be tested for fatty livers and things like that as well. So you'll be tested so that you can rule out stuff. And this is what will happen, okay? But at the end of the day, if all of the prospects are ruled out, so even if you've had x-rays, CT scans, colonoscopy, sigmoidoscopy, and there's no definitive answer on what it is, the doctor will just label you as you have IBS. So in other words, we're out of options here, so we'll just put you in the box of IBS, so irritable bowel syndrome. The reason why irritable bowel syndrome is easy to just diagnose is because it's a syndrome. We don't know enough about it yet. It's not a definitive disease. There are so many different levels to it as well. So just like Down syndrome, we don't know a lot about it, but we do know that we do have a collective of symptoms, but we don't know exactly what the definitive cause of it is or anything like that. And IBS is exactly the same. We don't have the definitive answer yet. We do need more testing and things like that. But here's the kicker as well. Okay, this is where it starts to grind my gears quite a lot when it comes to IBS. So it's just so much easier to be labelled as someone with IBS than what it is to educate someone. People would rather be labelled with IBS. I have IBS-C, I have IBS-D, I have IBS-M, blah, blah, blah. And it's much easier to tell someone that they have IBS rather than to say to them, you need to clean up your nutrition. Perhaps you should look at your stress management skills. Maybe your environmental factors and life choices need to be exchanged for something better. Because it's much easier to just put someone in a box and say, look, you've got IBS, you're going to have your good and your bad days, move on with your life, than what it is to say to them, well, you need to focus on your nutrition. You need to work out your stress management. Because so many people don't want to budge on that. They just want to keep on eating the crappy foods that they've been eating and then wondering why they're still fat. They want to, keep having their bad life choices and then wonder why they're still stressed out. They still want to stay in that shitty job with that horrible boss and then still go, well, I can't understand why it is that I'm so stressed at work. Move on. You're not a tree, okay? So because patients, when it comes to business in the doctor's industry, if a patient is cured, then they're lost, especially in the medical industry. So the medical industry is a business. As much as we may not want to believe in that concept, it is a business. Without people getting sick, they're not going to make any money. It's as simple as that. And business without money doesn't work. Now, I'm not saying that IBS isn't real, because it definitely is, but IBS is the side effect, just like obesity is a side effect. Obesity isn't an epidemic or, a chronic disease or anything like that. Obesity is a side effect of bad life choices. Sure, you might have PCOS or something like that, which is causing the obesity, but the obesity is a side effect. It's the same with IBS. IBS is a side effect of other things that are going on in your life, whether it's your bad nutrition, whether it's your stress management skills, you need to up them, whether it's the environmental factors coming to the internal source and then being deciphered incorrectly. That's what IBS is. It is a side effect to a core issue. And that's where hypnosis can help. It can help get down to that core issue and help you work out what it is that's going on for this side effect to keep on occurring. This side effect is a thing that's happening, a physical response that's happening to an emotional internal representation, so that way your emotions are saying to you, I'm trying to protect you, and if you're not going to listen to the good stuff, then I'll get you with the bad stuff, okay? So like I said, I'm not saying that IBS isn't real, because it absolutely is, but it is a side effect. You can't keep complaining about your IBS whilst you're going to keep having your bad nutrition. You don't have the right to complain about your IBS if you're going to keep putting yourself in those stressful situations and not get some other skills to cope with them, because it's going to lead to depression, it's going to lead to anxiety, and it's going to lead to much bigger problems, because IBS can turn into irritable bowel disease, and that's when you're literally up the creek without a paddle, because that is when push comes to shove. You will be forced into changing those nutritional needs, because your bowel will be dying, and you really don't want that, okay? So here are some things that I recommend after I've done the whole grind, authority, nag thing, people. So what are you that's more than your IBS? What are you that's more than that? Are you a creator? Are you a musician? Are you a gardener? What are you that's more than your IBS? Dig deeper into the truth. So if you're working with clients with IBS, keep on digging deeper. Shift the identity of IBS to, I need to work on my health and fitness. I need to work on my stress management skills. Dig deeper into that core issue. And if you have any questions or if you want to discuss it, then please just comment, because I'm absolutely all for that, because I am here to help, okay? So please join me next time. I'm going to be talking about IBS across the world. How is it different from the UK to the USA to Australia, and what's going on? If you'd like to join in our live event, then please absolutely do that. We will be teaching you all of the techniques, all of the situations that you could possibly be in. We will be teaching you absolutely everything when it comes to gut-directed IBS hypnosis therapy. And this year we're also giving you an audio for how to relax your child, because the little ones suffer from IBS as well. So we'll be giving you that audio too, and everybody will be receiving the bonus pack where you learn how to adapt the IBS protocol for Crohn's and colitis and even diverticulitis. Okay, so please join me next Thursday in my next video for IBS across the world and how is it different. Okay, have an awesome day, everybody. Bye bye. Mwah, mwah, mwah. Oh, and whilst I'm here, please, if you're watching this on YouTube, subscribe to the channel. Talk to you soon. Bye bye.